Welcome, everyone. It's a celebration day. It's the International Day of the Midwives. It's really lovely to see all the participants that are joining us from all over the world. We're joined here at in Geneva, the WHO headquarters. I'm Elizabeth Ero, the Chief Nursing Officer, WHO. In the room with me today is the Director for Maternal, Child and Adolescent and Aging, Dr. Anshu Banerjee. And also our midwifery expert in the room is Fran McConville, joined by our colleague from the Chief Nursing Officer's unit, Amanda Fern. Welcome, everyone. Before we move on to our official sessions, I just want to bring your attention to what has been on the screen, just to remind people of some of the housekeeping rules. We have English, Spanish, French, and Russian interpretation available. And if you find your interpretation icon and choose the language that you want to have your interpretation. We also ask if you can write in the chat box your name and where you are from, and leave any comments you want in the chat box and any questions. We may not have time for the questions to be responded to, but we would really love to have your questions. So if you can write your questions and add your name and email contact, we will respond to those. So thank you very much once again for joining us today. Good morning, good evening, good afternoon to all our colleagues from around the world. Welcome everyone to this World Health Organization virtual celebration of midwives. A special welcome to all our speakers and our panelists from around the globe. Really looking forward to hearing your sharing of your experiences from your countries, from your organizations in celebration of midwives. May the 5th is also the World Hand Hygiene Day. And we celebrate this also because midwives are role models for other staff through influencing behavior change towards adherence to effective hand hygiene practices, because achieving effective hand hygiene is integral to improving quality of healthcare. I would like to thank all midwives all over the world for all that you do, for your commitment, your courage, your compassion, and quality care that you are giving every day, everywhere, to help save the lives of women, newborns, children, and adolescents, and families. Despite the risk of working during the pandemic, midwives have continued to provide respectful care, even when essential healthcare services have been disrupted. This pandemic has added significant burden of risk and harm women and newborns are exposed to during childbirth, due to breaks in supply chains, women's inability to access care, and the shortage of skilled health professionals. Many have been infected and many have died. Many are struggling with mental health issues and burnout. We must look after our midwives that we have, as well as focus on recruiting more into the profession. Many of you have been steadfast and resilient. Although significant progress has been made in reducing maternal and neonatal mortality, the Sustainable Development Goals 3 targets are still far from being achieved. Even before the pandemic, approximately 810 women, 7,000 newborns died daily, with the causes occurring mainly around the time of childbirth. So it is not surprising to share that WHO has confirmed the theme for this year's World Patient Safety Day, September the 17th, is Safe Maternal and Newborn Care, with the slogan, Act Now for Safe and Respectful Childbirth. I look forward to seeing many of you engaged in this campaign. Midwives are critical to drive progress towards the SDGs by effectively providing a wide range of essential and sexual reproductive maternal, newborn, adolescent healthcare services. The data and evidence from the State of the World's Midwifery Report 2021 is timely, and this has also informed the global strategic direction for nursing and midwifery, which will be considered at the World Health Assembly this month by your ministers of health. Bold investments are urgently needed in midwifery education, working environments, workforce planning, midwifery leadership in health policy and service delivery. Whether you represent associations, academia or government bodies, or are a midwife working in hospital or in communities or in a midwife-led clinics, we all have a role to play in providing evidence and direction to ministers of health and support national policy dialogue around investment in the midwifery workforce in order to achieve the triple dividend for health, economic growth, and gender equity. Have a wonderful International Day of the Midwife in your countries, in your organizations, and look after yourselves and each other. I look forward to the discussion. Thank you. I want to introduce Director for Maternal, Child and Adolescent Health, Dr. Anshu Banerjee, who will make actually, we're very pleased that he's able to attend because he's been really inundated with the schedule. So Anshu, I'm really pleased that you are able to be here and to give us some comments, opening comments. Thanks, Anshu.
Thank you very much, Elizabeth. And I also want to congratulate all midwives on this particular day. And I think after we've had the presentation by Anneke Knudsen from UNFPA on the findings, the main findings about the report, we will appreciate even more how big the role is of midwives in delivering services for mothers and children. But we have an even more important speaker who wants to congratulate us with this day of celebration for midwives, and that is our Director General, Dr. Tedros, and we will hear from him now.
The International Day of the Midwife is an opportunity to celebrate the incredible contribution that midwives make to women, infants, and their families all over the world. Pregnancy and childbirth have not stopped during the pandemic. Midwives have continued to do their jobs, and some have lost their lives. We honor their service and their sacrifice. Today is a time to not only celebrate midwives, but also to ensure a safe and dignified workplace for midwives and to invest in their education and training. And all of that needs the leadership of midwives for midwives. To mark the International Day of the Midwife, WHO, the UN Population Fund, and the International Confederation of Midwives have come together to launch the State of the World's Midwifery Report. The report highlights the critical need to invest in midwives across the full range of issues: leadership, models of care and research, safe working environments, and policy design and implementation. Thank you to every midwife for everything you do. The world needs you more than ever. I thank you.
Thank you very much, Dr. Tedros. And I think Dr. Tedros' final statement that the world needs midwives more than ever is very applicable to all mothers and newborns and children in the world. So we will now come to the technical session of the session, and I would like to ask Anneke Knudsen, who's the Chief of Branch for Sexual and Reproductive Health with the UNFPA, to highlight the key findings of the Simi Report. Thank you. Over to you, Anneke.
Thank you, Anshu. And let me first share my screen here. Let's see if we get it to work. Worked for, can you see my screen in full picture?
No, not yet. It's with slides underneath.
Pardon?
It's got slides underneath.
Okay.
Yes, this is full picture.
Okay, good. Here we go. So, dear partners, colleagues, friends, dear midwives, sisters, and brothers, on this very important day, the 5th May of 2021, and on behalf of ICM, WHO, and UNFPA, I'm really thrilled to present the key findings of the 3rd Simi Report 2021. And I can tell you it has been a birth with a long first phase, compounded by COVID, but all is well, no major obstruction or blood loss, and we have a healthy report. And thank you all for your hard labor. So let me start with just giving a very brief background, although I don't think it's really necessary to say why this report is so important. But we all know that universal sexual, reproductive, maternal, newborn, adolescent health is a very essential component of the SDGs and the universal health coverage. And that better SRMNAH requires really investment in the health workforce. And we know that midwives play a pivotal role within the SRMNAH workforce. So that's really the basic justification. Let me then present some main headline numbers here. We know that midwives can provide about 90% of the sexual, reproductive, maternal, newborn, adolescent health care needed, but they account for less than 10% of the global SRMNAH workforce. The world needs 900,000 more midwives. By 2030, the midwife shortage will be smaller, 750,000, but still major. And I can tell you that in Africa, there won't be any change at all, because most of the improvement will be in middle-income countries and not in low-income countries. So why invest in midwives? We need to promote the health and well-being of women, adolescents, and newborns. We need to put safe and effective SRMNAH care within the reach of more people. And we know that from the data of the report and a paper published in 2020, that midwives can actually save millions of lives each year, estimated to 4.3 million annually if we have a universal coverage of midwifery-led interventions. That includes newborns and stillbirths as well. We know that we need to invest in midwives because they contribute to national and local economies. When women have their needs met, they can also contribute in another way to society and to their families. We also need that we know that we need to invest because it contributes to women's empowerment and gender equality, and not only for the women that midwives serve, but for themselves as well. What the report shows are 4 areas of investment that I'll go a little bit deeper into. It's the health workforce planning, management, and regulation, and in the work environment. It's high quality education and training of midwives. It's midwife-led improvements to SRMNAH service delivery at large, and it's midwifery leadership and governance, all mentioned by Dr. Tedros. And there are bold investments needed, both in quantity and quality. So let me first start with investing the health workforce planning, management, regulation, and in the work environment. So if we go by the same pace as we have now in the development on the numbers, increasing the numbers at the same pace as now, what we have in 2019 is that the global average, that 75% is met, potential is met of what the SRMNAH workforce can provide, but only 41% in low-income countries, 51% in Africa. So if we go with the same pace, in 2030, the global average will have increased a little bit to 82%, and very little also in the LICs and in Africa. So we also know that there needs to be an enabling gender transformative work environment. Because 93% of midwives, 89% of nurses, and 52% of SRM-NAH doctors are women. So there are 4 critical issues for midwives. It's leadership, decent work free from discrimination and harassment, gender pay gaps must be overcome, and there should be no occupational segregation, and we need to have interprofessional collaboration strengthened. So we know that gender transformative policies and measures are needed in society, and they are as much needed in the health system. The next one is the investment in high quality education and training of midwives that I would like to talk a little bit about. The quality of education and training is, as we know, critical, and that has been shown in many papers and in many evidence-based reports. But it varies a lot across the globe. And for midwife education, there are 3 strategic priorities that we need to focus on. That all midwives need to be educated to high standards and enabled to practice to their full scope. And that is beyond pregnancy and childbirth. And I'll come back to that. There is so much more that midwives actually can provide in terms of services. Midwives also need to be involved in education policy at the highest level. And we have seen in the report that faculty in Africa only to 50% consist of midwives. So we need midwives to teach midwives. And we need coordination and alignment of education processes. The next part of the investment needed is the midwife-led improvements to SRM-NAH service delivery. We need midwife-led models of care, midwife-led models of continuity of care. So we have seen in the report that universal coverage, as I said, of midwife-delivered interventions could avert 2/3 of maternal and neonatal deaths and stillbirths. But we also know that it contributes to continuity of care, which will improve outcomes, both physical and psychosocial. It will leave women with higher satisfaction and midwives with higher satisfaction. It will be potentially cost saving. There will be fewer unnecessary interventions, and there will be an increased uptake of contraception, immunization, and other services around the core of the scope of the midwife. So just a few sentences on how we see the optimized role for midwives. There is so much more that midwives can provide, and the wide range is shown in this graph, where we look at adolescent health and development, midwives delivering also comprehensive sexuality education in clinics. We look at other sexual and reproductive health services such as family planning, extremely important. And then we have the interpartum pieces, antenatal care, childbirth care, postnatal care. So we need to have fully educated, regulated, and supported midwives that actually are acknowledged for providing all of these services in the systems that they work. The 4th area is investing in midwifery leadership and governance. This heading, I think, is really very evident to many of us, but not to the global community maybe so much. Midwives should be where SRM-NAH decisions are made. As I mentioned before, women are a majority. 70% of the health workforce are women. But when we look at senior managerial positions, it's only 25% that women hold. We have also seen through the report that there are 51% of the countries that have a midwife leader in the National Ministry of Health. And I'll not go into the table, but what we also know is that the positions are at the lower level of administration, and that needs to change. And I would really like to call on all countries to look at their health systems to put in place senior midwifery officers to look at service provision, to look at satisfaction, to look at education needs. So my last part here is really to take just a few moments to look back at the previous results from previous reports and looking forward. So the progress since SOMI 2011 is that we have a much greater emphasis on quality of care, and that's extremely welcome, and that's what we see is needed across the health system, also for UHC, also for PHC, also for all what we invest in SRM and AH. Quality of care cannot be emphasized enough. There is also more recognition of midwifery as a distinct profession, which is important. And I was asked by a journalist yesterday from The Guardian, why is that so important? And I said, because the approach is really to make this life event of a woman giving birth the attention a normal birth needs, but also to be able to then identify the complications. But we can't lose track of the midwife accompanying a woman through a normal and life-changing life event. My last pieces here is really a bit more solemn. There is much more to do. There needs to be a higher availability and accessibility of midwives. There needs to be an increased quality of midwifery care. The enabling and work environment for midwives must change. We need to have better data, better quality data, but also available data. And last but not least, we need to be able to use all of this evidence, and we need to have midwives in place to really be able to build back better from COVID. Because these great returns from investing in midwives counts for everyone. Thank you.
Thank you very much, Anneke, and for highlighting these key findings from the report. And I was struck by the fact that we have this huge gap, but you were saying that by 2030, this gap will not have been reduced in the African region, while we know that by 2050, 50% of births will actually take place in the African region. And so this is really an issue of equity. And if we want every child to have the same chance at the beginning of life, we really need to be able to address this issue. So I really look forward to midwives taking up their leadership position. And I think we'll hear more about this in the panel. I want to hand over to Fran McInfill, who will take us through the panel discussion. Fran, over to you.
Again. Hello, everybody. Can you hear me? Yes, so good. And thank you so much, Anneke, for that. I thought that was fantastic. And I'm just to let you know, I'm actually in a room with Elizabeth and Anshu and Amanda, and that for me is a shock because I haven't seen them for 5 months. So I'm just getting used to how to do all this. So I think what we'd really like to do now is really hear from the people working in and with the countries and regions as to what all this means for them. And we have 6 fantastic speakers on our panel ready to have a conversation with us about what the Simi Report means and really about the realities of their lives in the countries and regions that they're working in, to help us really think through how we can take forward all the fantastic things that Anneke has just described forward. So we have I'm going to start on our panel with Harriet Chanza from our Malawi office. So Harriet, are you there? I know you're with us, and I'd like you to introduce yourself, please, Harriet.
Thank you very much, Fran. Good morning, good afternoon, good evening, everyone. My name is Harriet Chanza. I work in WHO Country Office, Malawi. I am a midwife, and I'm proud to be one, and happy IDM to everyone. Thank you, thank you. So my passion is really to make sure that all women are getting things that they need. Thank you, Fran. I'm hearing and
are you able to hear Harriet?
Yes.
Good. Okay, so Harriet, what we'd really like you to talk about is, what does this report mean in terms of education and training? It was one of the big 4 invests. We know that in Malawi, you're doing a lot on education. You have been investing for many years, but you've had a really tough time, as many countries have, with COVID. So what does this mean to you? Where does this take you now?
Thank you very much, Fran. First and foremost, let me say that midwives deserve respect and gratitude from everyone for the services they provide to women and their babies and the community at large. As WHO in the country office, I see that there is great demand and responsibility to work with government and all stakeholders to lobby for more investment in the education and training of midwives. As we've all heard, and which is true also for Malawi, more than 90% of midwives in Malawi are women. And this brings in an issue of gender equity and rights. And sometimes I always feel that maybe this profession is not respected much because most of them are women. So one of the things that we need to do is to support training institutions to produce well-qualified midwives. And many times training institutions are actually left behind when there's policy dialogue, when there's new evidence that has been generated. Most of the time, even in the dissemination, they are left out. So they need to be there. They also need to be part of the policy dialogue at the table, where policies are actually made as training institutions for midwifery. And also need to lobby governments to actually invest in training materials for midwives. Because sometimes when we go, one of the biggest training institutions in Malawi, you see the ratio of tutors to students is very, very high, that the quality of education itself is also affected. So this report will actually help us to lobby with government and other partners to invest in midwifery education. And also to make sure that the training institutions are well funded so that they can train these midwives to a capacity that they can provide. And one of the other things that I think with the COVID situation now, want to lobby that training institutions can have within the pre-service training, a module or at least a course in midwifery during emergencies. Because most of the times you find that we are grappling to say, how do midwives continue providing services? And even in the national response, you find that probably that is just a small portion that is really not well articulated. Mm. And also advocate.
Mm-hmm. Harriet, sorry, I was just going to ask you, with all of this going on and the limits on resources and everything, has this, with COVID as well, has this had an impact on burnout of the midwives in Malawi? Because presumably they're working so hard and doing so much. What has your experience been about that?
Thank you very much. Yes, there's been an effect, an impact, because already the health system was grappling with numbers, inadequate midwives on the ground. And with the increased workload, obviously burnout. Although the government tried to recruit more midwives, but there's still a gap. And we know that we still have midwives that have not been recruited. So the report is going to help us also to lobby for the government to actually recruit more midwives, to provide psychosocial support to midwives that are working hours on end. There are things in the communities that are happening, midwives being labeled as the people that are killing babies and women in the facilities. So those need to be, tackled. Provide, bursaries, provide some, motivation for the midwives to continue working hard. And also to make sure that even when they are sick, they get the best care that they have to get, because we need them on the bedside. And I want to end by actually, appreciating all the midwives, not just in Malawi, not just in Africa, but in the world, because they are providing services, especially in our part of the world, with minimal resources. So they need to be provided with resources, not just training materials, but even when they are on the bedside, they need a conducive environment for them to be able to provide the service efficiently and effectively. Thank you.
Thank you so much, Harriet. It's really, really important that we hear what it's really like for those midwives at the bedside, as you say, doing so much, with so little. And clearly the Simi report, those 4 areas are going to really help Malawi to focus and take forward those things. Thank you, Harriet, so much. So now I'd like to move to Pragati Sharma from India. Pragati, are you there? Would you like to introduce yourself?
Yes, Ran. Hi, thank you. Happy International Day of the Midwife to everybody present today. I'm Pragati Sharma from India. I'm working as a consultant for headquarters, WHO headquarters, and working towards building the capacity of senior nurse midwifery leaders in India.
Thanks so much for joining us, Pragati. And we know you're doing a lot of great work. And I'd really like you to talk about the point Annika made on invest in leadership, because as we know, India is really investing now in a huge number of midwives, this whole new cadre. But how is that being managed through leadership? What is happening there?
Thanks, Fran, for the question. And it's my pleasure to be present here today. So in India, in terms of leadership, since the midwifery implementation started in 2018 after the release of the midwifery guidelines, it was to an extent at the national level that all midwifery leaders were represented from different associations, organizations at the national policy-making table to an extent. Of course, there's so much more to be done, but we felt that there's a stark gap at the state level. And in India, the implementation unit, the program implementation unit is actually the state where all the education happens, the program services, midwifery services happen. So we felt there's a stark a gap in leadership capacity of senior nurse midwives. And because there's a difference, there is an absence of leadership capacity in the senior midwives, they are not able to engage beyond the clinical scope in the policy making table at the national level and at the state level. And more so because in India, health is a state subject. So the state has the ownership of whatever programs, and they can contextualize the programs at the national level based on the local context in the state. So here it's even more important that the midwives and the midwife leaders who are representing, be it educational institutions or associations or the government, have the leadership capacity. So as of now, I think it's great that the Simi report talks about investing in leadership, and India has moved a step ahead in doing that. And we are on our way to doing a leadership program, capacity building program in India.
That's brilliant, Pragati, and a real movement towards that step on leadership in the Simi report.
Yes.
With your experience in India, can you just let us know how a state level midwife leader would feel at the moment? Is she connected? Is she listened to? Is she involved in meetings? What would it be like for a midwife in those situations where they're trying to lead in a state in India at the moment, or even in the center in Delhi?
So I think now it's slowly changing. Midwives are being heard, but in my experience, I think the midwifery initiative needs to be led by the midwives. So there's so much more to be done. And as of now, we can see that things are still working in isolation, and midwives still do not have a bigger space at the policy table.
And so then in this leadership training, you mentioned something about networks, and it would be really nice to know what these networks mean and whether or not they'll be evaluated in the future so we can all learn from it.
Right. So in this leadership capacity building program, which is now a pilot program, it is being implemented in 6 states in India, and we have representation from each state. We have 3 participants represented from the government, from the association, and from the education institutes. And through this, we really aim to enhance the leadership capacity of the senior midwives to be able to, participate in the policy-making progress. And we do hope that this will be evaluated maybe 6-7 months down the line, so that we see an actual impact of this is actually taking the midwifery initiative program forward in India. And also we do hope, because this is one of a kind, and I think one of the first program that's happening in India, we do hope that through this, we are able to create a midwifery network so that they can be in touch with each other, because we feel that I think midwifery leadership happens if midwives are more in number, and really number is the strength. So if we have 3 people from one state, for example, I think they have more connection and they have more strength to work as a state trio rather than working individually. So I think this network with 3 people and enhancing beyond 3 people, I think, and WHO India is investing in leadership, and we hope to have a network which is for now in India, and maybe they'll be able to get in touch with other global midwifery leaders in the future as well.
That would be amazing, Pragati, and the idea that they can connect with each other within a state and then across India, and that we can learn from that, because how do you implement a program of this size in a country of the size of India and support each other to do it the best you can? So I think that's really exciting, and it's really good to hear that despite
very exciting
that are happening during this pandemic, that this is still moving forward. So thank you so much, Pragati. Really good to hear your voice. And now I'm going to go to Georgia Cartes, and congratulations to Georgia for becoming the first Chief Midwifery Officer in Chile. Historically, this is absolutely brilliant. So Georgia is going to speak in Spanish. So I'm going to start listening through my translation. So Georgia, what we wanted to know about you was this invest in midwife-led service delivery. And Chile has a long, long history of midwifery. And it'd be very good to hear from you about what that means and what the Simi Report now means for you about midwife-led service delivery in Chile. Thank you, Georgia.
Hola, buenas tardes, buenos días o buenas noches a todos. Feliz Día Internacional. Sí, para nosotros como país, nosotros llevamos una larga trayectoria. Como matronas llevamos 186 años, ¿ya? Efectivamente, este informe para nosotros es una gran oportunidad para poder hacer cambios en todo lo que respecta a la matronería en nuestro país. Yo creo que tenemos una trayectoria, como les contaba, en todo lo que es desde la atención primaria, en donde nosotros podemos evaluar a nuestras gestantes, a los niños, ya los recién nacidos, y hasta el parto propiamente tal, y todo lo que es planificación familiar, salud sexual reproductiva. Por lo tanto, este informe para nosotros nos viene muy bien, porque en el fondo el hecho que yo esté ahora en una posición de liderazgo acá en el Ministerio de Salud, efectivamente me puede ayudar a poder lograr lo que ya algunos países europeos ya lo tienen, que es el poder tener cuidados progresivos en matronería. Yo creo que esa es una visión que deberíamos tener. Efectivamente, acá en Chile nos falta un poco más de autonomía en todo lo que es la atención de la mujer. Nosotros tenemos todavía acá un modelo muy medicalizado, y efectivamente yo creo que este modelo, este informe, perdón, nos ayuda en poder sensibilizar y concientizar a todas nuestras autoridades de la importancia que tiene la matronería en nuestro país. Para nosotros ha sido una gran lucha que nos puedan escuchar, que nos puedan considerar en la toma de decisiones. Creo que este cargo ha sido un gran paso y se agradece a las autoridades del país, porque efectivamente es un hito para nosotros que la matrona pueda tener a nivel de toma de decisiones un poco más de voz. Es un camino que inicialmente estamos haciendo. Yo llevo en este nuevo cargo 7 meses y creo que he tratado de poder hacer lo máximo para poder desarrollar todos los servicios que corresponde a nuestra profesión, a la matrona. Efectivamente, yo creo que aún falta, tenemos que trabajar más en conjunto. Se han hecho trabajos muy interrelacionados entre el Ministerio de Salud, el Colegio de Matronas y la ACM, que nos apoyamos mucho desde que iniciamos este nuevo cargo. Así que solamente decir que para nosotros esta es una gran oportunidad de seguir visibilizándonos, de seguir diciéndole a las autoridades la importancia que tienen las matronas acá en Chile y que efectivamente necesitamos el poder incorporar el recurso humano que nosotros nos falta, porque en el fondo sin el recurso humano de matrona claramente no vamos a poder lograr tener la atención de calidad que nuestras usuarias merecen acá en nuestro país. Gracias. No se escucha. No se escucha.
My mic is not on. No. Okay, it's on now. Sorry. Georgia, I was saying thank you so much. And it's so important to have you as the first Chief Midwife of Chile here today. It really means a lot. And you've got a lot of work to do, and we can see and feel your energy. And I picked up the focus on the autonomy of midwives and the history of midwives in Chile. And I think all of us want to wish you a huge amount of luck and goodwill, and we will keep in touch with you and support you to do your job as much as possible. So thank you so much, Georgia. Really great to have you. So now I want to talk to Maggie Langin in the Euro office, because Maggie has been managing a huge program around governance and leadership in Europe. And Maggie, this report you've been very involved in, you're really great at pulling all this together. So how does this Simi report relate to what's happening across the European Union at the moment? Thanks.
Hi, thank you, Fran, for this opportunity. I just want to correct you. We're not the European Union, but the European region. And I emphasize that is that we actually work with 53 member states, as far east as Uzbekistan, Pakistan, and Israel, and as far west as Iceland. So just to sort of capture the complexity of challenges that we face in the WHO European region, I just really wanted to emphasize that for everyone. And it's really great to see some of our colleagues from Uzbekistan participating in today's meeting. Hello to you, Dobry dzień. But yes, so we've been working in the WHO region on two fronts. One is really this piece about leadership and partnership between the various stakeholders that are important to strengthening nursing and midwifery. And to this end, we as a European region gather our stakeholders every 2 years. And in the most recent discussions, indeed, Fran, we have been working on a roadmap for implementing the global strategic directions on nursing and midwifery in our region. And so for that conversation to happen, we need to have very strong relationships, not only with associations, not only with our educators and academic institutions in midwifery, but also with leadership, government leadership. And that, I would say, is a second front on which we're really working, is to strengthen the role of and introduce the roles of chief nursing officers and chief midwifery officers. I'm sad to say that we don't have a lot of chief midwifery officers in our region. But to this end, I think we are really working hard to pull these people together, not only at the regional level so that they can inform our roadmap, but also so that they in their countries can connect and network. And the third front, I'll say, so the first front being leadership and having these roles. Second, that we have these partnerships between them to influence and comment on the important areas of regulation, education, job, leadership But the third point is to have this conversation around models of care. And I think that this is really an important piece. And I really liked George's intervention where she spoke about the importance of moving away from the overly medical model. And that's what the Simi report tells us, is to focus the conversation on moving to the community. And so when we have those conversations, we are not talking just with these partners of the educators, the chief nursing and midwifery officers, and the associations about how to strengthen regulation, but we're inviting them to conversations with our primary health care planners, with our child and maternal health colleagues. So when we go to countries, we really try to focus our ministries on not just the conversations for midwifery's sake. What are the models of care that you really want to establish in your countries? And for this, the Simi report is a really good tool for us to say, this is what you can achieve for child mortality and for maternal well-being. And that's when we bring on our stakeholders. You're on mute.
Doing this. I'm back again. So Maggie, just to say thank you again. I really like the way you've brought together the models of care with governance and leadership across a whole region, the European region. So taking it from different countries to see how this can play across, and your roadmap. It will be really interesting to see how that plays out and to see the influence of the Simi report. And I totally agree with you, being able to say now very clearly midwife-led models of care. I think it's going to have a huge impact on the future direction of travel. So now we're going to take a really big jump from the European region to the Solomon Islands. And very, very welcome, Michael Larui. Please do introduce yourself. Are you there, Michael? Have you been able to join? I know it is the middle of the night.
Hello.
Oh, good, good.
Yeah.
Yes,
So
hello,
yeah, good morning from Solomon Islands. This is past it's going past 1 o'clock in the morning. So I'm Michael. I'm the Director of Nursing and Midwifery and Chair of the Nursing Council Board of Solomon Islands, a little island country in the Pacific of 700,000 population. And so I would like to, first of all, congratulate everyone on this very important day, the International Day of the Midwives. And I also wish to thank the organizers for inviting me to be in the panel. I also would like to acknowledge the International Confederation of Midwives, UNFPA, and the World Health Organization, and those who have contributed to the production of the State of the World Midwifery Report 2021. Truly, midwives play a pivotal role within the sexual, reproductive, maternal, newborn, and adolescent health workforce. And I am so glad to be joining you as a panelist. So, Fran, where's next?
Thank you so much, Michael. And it's really, really good to have you from the Solomon Islands. I know it's a very beautiful place, but obviously huge challenges for midwifery. And in terms of your role, in terms of workforce planning, management, and the working environment, that came out strongly as one of the 4 invests in the Simi report, how do you do that in the Solomon Islands, where people are on very isolated islands and very spread apart with a population of that size? What does this report mean for you, and what changes might it bring to you?
So thank you, Fran. As you rightly said, so Solomon Islands, as an island nation in the Pacific Ocean, timely access to quality healthcare is very challenging due to the scatteredness and remoteness of islands and atolls. And so in this report, having looked at the workforce planning, I tend to see that workforce health workforce planning really depends on health workforce data in order to have a better understanding of challenges and issues. And as highlighted in the report, I do agree that the importance of a robust health workforce data system is very important. I also refer to the report of the Pacific State of the Pacific Reproductive, Maternal, Newborn, Child, and Adolescent Health Workforce 2019 report that also states that understanding the current state of reproductive, maternal, newborn, child, and adolescent health workforce is necessary to identify the challenges which needs to be addressed. And in Solomon Islands, while this is also the case, our human resource for health data needs to be improved. I see in the presentation the 10 essential data items for midwifery planning as very important to help us properly assess and determine the numbers of health workers involved in providing sexual reproductive, maternal, newborn, and adolescent health. There is a National Nurses Conference that we're organizing for July of this year. And this is where we will bring together nurses and nurse midwives to come together and look at the way we record HR and more especially those working in primary healthcare facilities, which include nurse midwives and nurses who also practice midwifery, who also undertake midwifery roles in the rural health facilities. In terms of the health workforce planning front, I totally agree on the presentation that deployment plans are very important for strengthened service delivery. In Solomon Islands, we've developed our midwifery school in 2000 and with support from the World Bank. But then over the years, the school has progressed. It is now one of the strands of a Bachelor of Nursing degree that we offer at the Solomon Islands National University. The strategic plan then was to deploy nurse midwives to every health centers in the provinces, and that a nurse midwife must be available at every shift in hospitals. But we have a lot of challenge. One of the challenge is that not all trained midwives were redeployed to areas where they can practice the knowledge and the skills they acquire. Attrition, both voluntary and through official deployment, is a challenge to the strategy of midwifery distribution to health centers. And so, but in Solomon Island situation, we see that nurse midwives have been supported and given opportunities to provide a range of midwifery services. Because in a country where there is really a critical shortage of medical doctors, nurse midwives are always relied on for obstetric interventions. So the other area is in the collaboration with education providers about enrollment and employment, which is very important, especially at this time when our major recruitment agency, which is a government, has placed moratorium on recruitment. We have been discussing with education institutions and the government to look at how best we can continue to recruit nurses and nurse midwives to continue carrying out the care that is very much needed, more especially in the rural health facilities where 70% of service users live. Also, maybe I would close with nurses who actually work in primary healthcare settings. And as part of our workforce planning, I cannot agree more with the importance of primary healthcare and sexual reproductive, maternal, newborn, and adolescent health. With my experience as a community health registered nurse who have spent 10 years in the rural health centers, most of what we do there involves sexual, reproductive, maternal, newborn, and adolescent health. For instance, all week round, a rural registered nurse will carry out antenatal, family planning clinics, attend to deliveries, postnatal care, immunization, outreach, health promotion, including sexual and reproductive health, education, and referrals of obstetric emergencies. One of the challenges I see here is that we have, with our school, we have been training a number of nurse midwives already, but the challenge we have is you will find most of the nurse midwives only in the urban centers and less of them in the rural facilities. And so having trained midwives to take leading role in primary healthcare is very important. And I cannot agree more with that point, because this is where we improve and strengthen SRM and AH services in the rural areas, like I said, where 70% of service users live. Fran. I think you on mute, Fran.
Putting myself. Can you hear me now?
Yes.
You can hear me? I don't know why it says that.
Yes. Yes.
Michael, I just wanted to thank you for all of what you said, because the challenges that you are facing in the environment that you're working with are huge. And in trying to bring a focus on quality midwifery care into all of that through the data and deployment, and really looking at how you can get that midwifery care into all these very remote and isolated places is huge. So we really, really welcome that. And it's really, really excellent to hear the reality that you are facing. So thank you very much. And now we're going to go to our last speaker, Roa Altawelli. Roa, would you like to introduce yourself? Roa, can you hear?
Hello, everyone. We can't see you, Fran. The camera just...
Oh, the camera's got stuck, I think.
Yeah?
Just go ahead, Roa, then we'll see you. That's great. Yeah. Important that we see you.
Okay. All right.
Please introduce
Happy International Day of the Midwife. Thank you, Fran, for this kind introduction. It's my great pleasure for me to be here today as a board member of the Eastern Mediterranean region. And I am a registered consultant midwife from Jeddah, Saudi Arabia. I am a founding board member and chairperson of the Saudi Midwifery Group. Currently, I'm working as the director of Midwifery Department at Ministry of Health. There is an echo. I hear myself twice.
It's fine, Roa. We can hear you very well.
Okay, thank you. I'm really happy to see the launch of the Simi report with the collaboration of UNFPA, WHO, and ICM. It's very crucial report for all countries in my region because the theme of this year, ICM theme for IDM, is follow the data, invest in midwives. And it was chosen because it corresponds with the launch of the State of the World Midwifery Report. This is the third report for midwifery, and we had benefit from the previous two reports about the status of midwives in our region. It provides midwife leaders with evidence they need to support and strengthen regional advocacy effort. We know that data is important. If we don't have data about how many midwives, separate from nursing data, because some countries in the region conflate numbers of nurses and midwives together, and that make planning for midwifery difficult, and we don't know how many midwives we need and what is the shortage for midwives to cover birth in the region. So I think being a midwifery leader in my region and in Saudi Arabia changed a lot. I think without having leading midwives, that will make the challenges more difficult for midwives to function as a midwife in any country.
And Roa, if I could just at that point, I want to congratulate you because you are the first director of midwifery in the Ministry of Health in Saudi Arabia. And that in itself is a huge progress, but that must have been hard. What happened in Saudi Arabia that we can learn from that took a ministry that didn't have a director of midwifery specifically to move to your position and for you to be there now? It'd be really good for us to hear the process that took. Thanks.
Yeah, thank you. Obviously, 5 years ago, I finished my PhD. I came back to Saudi Arabia and I joined the Ministry of Health as a midwife. And midwives were under nursing leadership. I found them struggling in many things because nobody understands their scope of practice. They have difficulty to practice midwifery. And some people think they are midwives, some people think they're nurses or nurses' aid as well. And some of them, they don't give them the opportunity to practice midwifery fully. And then this affected midwives because the level of education were direct midwifery education, 3 years diploma. And these midwives were voiceless. They didn't have a leader to lead their profession. So after 3 years, I joined the General Department of Nursing and Midwifery Affairs by having a new department for midwifery. And this midwifery department was initiated 2 years ago in 2019 to regulate the midwifery profession and to advance the midwifery profession. So now we have almost 22 regional coordinators in Saudi Arabia that considered as regional leaders in midwifery. And this is all with the support of the reports, international reports like ICM report, competency. We had developed a midwife guidebook based on the ICM competency scope of practice, and that give direction for midwives and also in terms of registration. We have a unique registration for midwives separate from nurses. And that is now clear because before we were, they were conflated between nurses and midwives. So now the profession of midwifery is very clear. And I think this is because of midwives, leading midwives. And some countries in our region still have lack of this leadership role. And I encourage and advocate for all these countries to have leaders to direct the midwifery profession and to know what is the challenges midwives suffer during their daily practice.
Roa, thank you. That was a really interesting description of how you went into a Ministry of Health, helped to set up this directorate, and have now become a chief midwife. And clearly, the profession of midwives in Saudi Arabia is being seen as distinct from nursing, and you're getting all those support for education, everything. That's a huge work that you have done. And I think all of us are really, really proud of you for having moved that forward. So I want to stop here and just thank the whole panel. It's been fascinating to hear different views from different countries with different experiences from all our 6 regions. And I think that placing this in the Simi Report and what it really means is helping us to think how we have to move forward now. So huge thanks to the panel. And with that, I would like to hand over to Sally Pearman, Chief Executive of the International Confederation of Midwives, so we can really wrap up the celebration of International Day of the Midwives 2021. Sally, would you like to come on board, introduce yourself and say hello to all of us? I think we all know who you are.
Thank you, Fran, and thank you very much for the invitation to be part of this really wonderful, inspiring webinar. And happy International Day of the Midwife to you all. It's great to see so many people on the webinar. This day, every year, gives us an opportunity to come together as a global community of midwives with partners to celebrate our very unique profession and the incredible work that we do as midwives. And at ICM, we have today been hosting a series of virtual parties, bringing together midwives associations from various countries, across regions and in language groups, celebrating the amazing diversity of midwives. And we've been asking midwives to tell us why midwives matter. And I just want to tell you a little bit of what we've been hearing. That midwives have been supporting women in childbirth since time immemorial. That midwifery is the oldest profession, that midwives promote health and normal birth, prevent complications, save lives, build women's confidence to give birth and become mothers. That there is a midwife for every woman, recognising the incredible diversity of women and midwives across all cultures and in all countries of the world. But that no matter where we live or what makes us different, what makes us the same is universal. Our shared passion for our work, our shared sense of wonder and appreciation of the power of women as they bring new life into the world, and our shared sense of dedication and commitment to supporting women to be strong and to take hold of their own power and to be working together as a profession to demand our autonomy and our place at the table. And most of all, our shared sense of pride in our profession and in being midwives. This last year has been incredibly challenging, and the so-called new normal is not yet in sight. And midwives have really stepped up when health systems have fallen around them and when the support that they should have been able to rely on has not been there. In so many countries, it is midwives who are keeping the maternity services running and who are making sure that women can still access the care they need. And we've heard some of this from the panel today about how hard this work is and what a toll this is taking on midwives and on women. At ICM, we've seen amazing innovations as midwives have worked out how to do things differently, how to reach women in their homes and communities, and how to keep supporting each other and hold the profession together. And we know from the State of the World's Midwifery Report and from our own experiences that alongside these inspiring stories, there are many more that bring us to despair and show that COVID-19 has made worse existing gender discrimination, family violence, human rights abuses, over-medicalisation, and so on. We know that sexual, reproductive, maternal, newborn and adolescent health outcomes are being made worse by COVID-19 and our challenges are even greater. That's why it's important to have a day like today to help us remember that we are all in this together and to celebrate all the positive impacts that we can make. For ICM, the COVID pandemic has enabled us to use virtual technologies to connect more with our member associations and regions, increasing equity as more midwives and members have been able to engage with our activities and with each other. And we're excited about what lies ahead. Our new triennial strategy gives us a clear direction to build the sustainability of ICM, to strengthen the midwifery profession through the rollout of our new professional framework, and to foster a movement for midwifery. The Simi Report, launched today, is a wonderful collaboration with WHO and UNFPA that we are thrilled to be part of. It gives us a solid base of evidence for advocacy and guidance to the steps that need to be taken in countries to ensure a midwife workforce to meet the sexual and reproductive health needs and rights of all women, their babies, their families, including adolescents. ICM's Global Midwife Hub, set to launch later this month, will incorporate findings from SOMI and other data sources, feeding into an easy-to-use digital platform that midwives and their associations can use to draw actionable information about the state of the profession in their country, including details of midwife numbers, midwifery education, and primary health services. We're going to discuss the Simi Report again at the first plenary session of our upcoming virtual triennial congress, running every Wednesday in June. And we hope that we see you all there. And just a reminder that it is not too late to register. At the Congress, we're also going to be launching our Decade of the Midwife campaign with many partners. And this campaign is going to provide focus for our collaborative work over the coming years. So there's much to do, but we are invigorated by today and by knowing that the global midwifery community has so much support from important partners like WHO and UNFPA and many others. There is more and more recognition and of course evidence that midwives can make a difference if they are supported in the right way and enabled to succeed. Thank you to all the midwives for all that you do. But our time is now, so let's keep moving forward together. And once again, happy International Day of the Midwife to you all. Thank you, Fran.
Thank you very much, Sally. And so we come to the end of this session. It's been wonderful, I think. We heard wonderful stories of leadership. I think it's very important that this leadership will translate into policy dialogue at country level. And people have highlighted some of the issues that we need to highlight within the policy dialogue, such as midwifery-led models of care, the need for data in order to actually have a discussion and a policy dialogue. And I also think that, you know, the whole issue of midwifery really contributes to improving quality of care and equity. So we need to use this report. I think that's why we have reports, not to be put in the shelf, but really to use them. And I hope that each country will be able to use this report. We hope that you as midwives will disseminate the findings of the report, but also that you will engage with your ministries of health, with your chief midwifery officers or chief nursing officers or chief nursing and midwifery officers, with the ministers of health, and really highlight the findings of this report and why it's so important to invest in midwifery. And this time, because of this virtual world, actually, we don't have just one launch of this report. We have a series of launches. And as Sally just highlighted, there's going to be discussions around the report also as part of the triennial conference. But we're also going to have a policy dialogue with Ministries of Health on the 18th of May. And I would like to call on midwives to mention this, to discuss this with their Ministries of Health, because we would like to have the highest level of representation. During this policy dialogue, we'll have Natalia Kanem, the Executive Director of UNFPA. We'll have Franca Cadet from the ICM as well. And we'll also have Dr. Tedros present during that policy dialogue. So we really look forward in order to be able to sensitize from our side the highest decision makers at the Ministries of Health around the importance of midwifery. And we hope that you'll be able to support us in getting them to attend the meeting as well. So having said that, I would like to thank the interpreters. We have gone over time a little bit. Thank you very much. And also our IT department for supporting us, and looking forward to see you at another meeting. Goodbye.
Bye. Thank you.
Thank you. Happy IDM.